welcome to Better Health Together, and this is the last Better Health Together for this year. And I have with me the WA Primary Health Alliance Chair, Dr. Richard Choong. And Richard, this is a conversation really from your perspective, given you've been with WAFA since we began. And one of the things that stakeholders often say to us is that they don't fully understand what we do. If you're able to summarise that from your perspective, what would you say?
Well, there are several things that we try and achieve. The first is to ensure that the fabric of the healthcare environment that exists outside hospitals is improved and developed further to ensure that we get the right patients getting care at the right time, in the right location, with the best possible outcomes. And that sort of leads down the path of our commissioning services. Identify the areas that we need, identify the services that we can deliver, and ensure that we get the best possible outcome for the community and for the patients. But really the big issues that we have is that the system, we try and improve the system. There are areas which we're very proud of, right? That's alcohol and other drugs, mental health, our Aboriginal health. Also trying to improve general practice and its integration and coordination with the state system. Patients don't often realise that there are actually two systems. I mean, to them, and rightly so, they think it's one giant system, but it's actually two almost competitive systems which we've just got to bridge. And if we can make them better integrated, we'll get a better outcome.
And so in that 3 years, or 3.5 years you've been our chair, what are your reflections of that 3-year window? It's gone very quickly, but what would your reflections be?
I think it's gone incredibly quick. And if I think about what we faced in year one, and that was a lot of scepticism and negativity about whether we would be able to succeed. I think that we are well on our way in proving those skeptics wrong. I think that we've matured as an organisation, we're coming of age, we're making an impact. Now, what we want to achieve is not that patients necessarily realise that there's been a change, but they just reflect and think back that their lives are easier and better, and those that slip through the gaps are no longer slipping through the gaps. That's the most crucial part of what we do.
It's improving health outcomes for those that we know their health status is poor.
That's absolutely correct, because as a whole, I think this state enjoys a reasonably high level of healthcare, and I think we can be proud of it. But what we can be really embarrassed by are those that slip through the gaps. And I'd like to see that our organisation is there to almost stop those gaps from occurring and ensuring that across the whole state, people get equitable access to healthcare.
Yes. So if you were to look ahead another 5 years and think that we've been successful, what would that actually be? What would that look like?
I think that we can't ever achieve the utopian society of having everyone, be it whether they live in the CBD or they live out in Fitzroy Crossing, having the same access. But I think in 5 years, I'd like to see everyone have improved access. Be it whether they live in the centre of Perth or whether they live in Fitzroy Crossing, I'd like to see them sit back and go, yeah, my life is better. And that's better because I have better services, better access to those services. And my friends, my family and myself, we have better health. I think that's where we want to be.
And that's in the eye of the person themselves. So one final question. What do you think WAFA's greatest assets are, and also its greatest challenges?
Its greatest assets are really easy to explain. That's our staff. There's no doubt in my mind about that. We have wonderful staff. We work together towards doing it right, doing it right and doing it better. Our greatest challenges are those people that will always try and take us down and say we are making no difference, yet they themselves do nothing to change the system.
And that's just the tension that we walk. So thank you very much, Richard, for those words, and thank you all for watching Better Health Together. Hope you all have a very safe and happy Christmas, and we look forward to seeing you in the new year. Bye for now.